I think that one of the important things is to recognize that there are a lot of forms of exercise that work, number one. That if you look at leisure time surveys, most individuals choose to walk. In fact, surveys would indicate that about 47% of women and about 30% of men walk on a regular basis. And they incorporate somewhere between 6,000 and 7,000 steps per day. And so I think we know from the literature that it doesn't have to be in a single bout, that you can exercise 10 minutes after breakfast, 10 minutes after lunch, 10 minutes after dinner. And walking is one of the best forms of exercise for individuals who are really busy, who are at desk jobs. I think and that forms a basis for helping people. There have been about at least 3 meta-analyses looking at pedometers. And it turns out that people that utilize a pedometer walk on average 2,000 steps or more than individuals per day that don't have pedometers. The important thing there is that we should prescribe exercise in terms of a regimen for people in utilizing their pedometers. And we know that if people continue to use them, that they will continue to exercise more than individuals that don't wear them. So wearing them on a regular basis is really important. I think that one of the most important things related to looking at motivating people to exercise is to look at people's preferences. And we know from some of the literature that when you combine 2 or 3 forms of exercise, so you might walk one day, bike the next day, or bike and swim, that kind of thing, that people have a tendency to stay with exercise longer and get more enjoyment out of it. So exercise doesn't have to be in one form. You know, we should really consider 2 or 3 forms, but patient preferences or individual preferences certainly make a difference. We've gotten way beyond that. And I think the important thing for individuals to recognize is that moderate intensity exercise, not vigorous, but moderate intensity exercise shows a 27% reduction in overall total mortality. And that when you vigorously exercise, it's about a 50% reduction. But doing moderate intensity exercise for a slightly longer period of time is as important for individuals than having to go to a gym and or run a marathon, doing vigorous intensity work. Well, I think that there are a lot of factors associated with motivation, and it turns out that one's success is probably the most important intrinsic motivating factor. So going out and having success and knowing that you've done something and done it well, helps to motivate even the next time, even if you've fallen off the wagon, from exercise. And I think the other thing, it's important to recognize that if you have fallen off, that you start back very slowly, so that even 10 minutes of exercise, 10 minutes of walking, for a week's period of time, and then gradually increasing that to 20 minutes, can be extremely helpful in getting you back on track. The other thing that we know that works to motivate individuals is self-monitoring. So when you begin to write down what you're doing and how much you're doing, simply as is similar in utilizing a pedometer, you're much more motivated to continue. In 2013 alone, on Google Play and on iTunes, there were 20,000 apps for health and fitness. And the majority of these apps around fitness actually provided an opportunity for ways in which people could self-monitor and could set goals, often coming with videotapes, those kinds of things to help individuals. So if you have to stay at home, there are methods to exercise, in the confines of your own living room. There are all sorts of opportunities for people with chronic disease to exercise utilizing chair exercises by obtaining videotapes, those kinds of things. And certainly in some cities, like Minneapolis, Chicago, we have a lot of malls in which people can go to and take advantage of exercising in those environments when the weather is really, really cold. Doctors play a major role. About 1 out of 3 physicians now prescribe exercise for individuals. We'd like to see that climb to 2/3 to, all of physicians prescribing exercise, because it has such incredible benefits in looking at reducing or increasing survival. And I think the important thing for physicians is to utilize their prescription pads, just as they would prescribing a medicine, to utilize prescription pads in terms of talking with patients and deciding upon goals in relationship to exercise. Same thing in terms of the use of pedometers, that prescribing a program utilizing a pedometer is critically important.